Is late-onset schizophrenia linked to dementia or other cognitive disorders? Have you ever wondered how late-onset schizophrenia connects with dementia and other cognitive disorders? This is a vital question, especially as our population ages. Late-onset schizophrenia is defined as schizophrenia diagnosed after the age of 60. Research shows a notable link between this condition and dementia, although the exact relationship is complex and not entirely clear. Individuals diagnosed with late-onset schizophrenia face a significantly higher risk of developing dementia compared to those without schizophrenia. Studies suggest that these individuals may be 3 to 4 times more likely to develop dementia. This increased risk is especially pronounced during the first year after the diagnosis of schizophrenia, but it remains elevated for many years afterward. Interestingly, late-onset psychotic symptoms might sometimes serve as an early indicator of dementia rather than being a standalone diagnosis. Both schizophrenia and dementia share overlapping symptoms, including delusions, hallucinations, and changes in behavior. This overlap can complicate the diagnosis process. For instance, certain types of dementia, like frontotemporal dementia, can mimic symptoms of schizophrenia, leading to potential misdiagnosis. Cognitive deficits are a core aspect of schizophrenia, and these issues can persist as individuals age. However, many older adults with schizophrenia do not experience significant cognitive decline when compared to their healthy peers. This observation has led to the idea that schizophrenia may represent a syndrome of premature aging rather than a direct cause of dementia. Several biological factors, such as neuroinflammation and microglial activation, have been linked to both schizophrenia and neurodegenerative diseases like Alzheimer's and Parkinson's disease. This suggests that there may be shared mechanisms that increase vulnerability to cognitive disorders in individuals with late-onset schizophrenia. Other risk factors that contribute to dementia in older adults with schizophrenia include age, low educational attainment, pre-existing cognitive dysfunction, cardiovascular disease, the use of multiple medications, and a history of substance abuse. Long-term use of medications with high anticholinergic effects, which are common in treating schizophrenia, is also associated with cognitive deficits similar to those seen in Alzheimer's disease. It is essential to differentiate late-onset schizophrenia from dementia with psychosis for effective treatment and management. A careful evaluation is necessary to determine whether the psychotic symptoms in older adults indicate schizophrenia, an early stage of dementia, or a combination of both. Treatment strategies should aim to preserve cognitive function and manage symptoms while considering the increased risk of dementia. In summary, late-onset schizophrenia is closely linked to a higher risk of dementia and other cognitive disorders. However, it remains unclear whether it acts as a distinct condition or an early sign of neurodegeneration. Accurate diagnosis and tailored care are vital to address the overlapping symptoms and improve outcomes for older adults affected by these conditions.